I'd like to turn now to the second sleep disorder that we'll be talking about, obstructive sleep apnea, and then we'll sort of circle back to talking a bit more about sleepiness in general. But in Kitty Lou's situation, she has obstructive sleep apnea, and I'm going to just say a few sentences about that, and then we'll dive into your experiences. Obstructive sleep apnea is actually a very common sleep disorder, and it's characterized by snoring and repetitive partial or complete obstruction of the upper airway. So the individual has trouble ventilating during sleep. And because of that, they may have drops in their oxygen level, and they often have repetitive arousals, and these are usually partial arousals. The patient is not fully awake with each of these, and so they may not remember or be aware that they're having this sleep disruption. It's sort of beneath the surface. And because this is a repetitive process and it happens over and over, the individual is not well rested, and they generally have what is known as a non-restorative sleep pattern. They don't wake up feeling refreshed, and they struggle during the day with fatigue, sleepiness, often have trouble with concentration, focus, may have trouble with emotional lability, moodiness, grouchiness, things like that, which I'm sure I cannot imagine you having that. But those are very common problems, and many of our obstructive sleep apnea patients are in fields of work where being sleepy may have a very negative impact. For example, individuals who are pilots, air traffic controllers, bus or truck drivers, whose alertness is directly related to safety. And so we certainly spend a good bit of focus on that. Obstructive sleep apnea is like most other disorders. It comes in mild, moderate, or severe forms. And to some extent, the treatment options parallel where the person falls on that spectrum. But for most individuals with moderate or severe obstructive sleep apnea, the number one therapy is known as nasal CPAP, and that's CPAP, and it stands for Continuous Positive Airway Pressure. It is a little mask or nasal prongs that the individual wears when they're sleeping. It's connected through tubing to a small machine that's about this big. It sits at the bedside. The machine produces a positive flow of air through the tubing, through the mask, into the upper airway, and it serves as a stent to help open the upper airway to improve ventilation during sleep. And so that is the 60-second introduction to obstructive sleep apnea and the treatment. Kitty Lu, tell us a bit about your experiences with sleep apnea before you were diagnosed.
Well, it's really interesting. My son was diagnosed with narcolepsy, and I thought, well, that must be what's wrong with me, because I would fall asleep during conversations, standing up at stoplights, and I thought, well, it's obviously narcolepsy, and I was really surprised to find out it was not. My daughter is a nurse anesthetist, and she stayed with me following a surgery, and the next day she said, "Mother, you have sleep apnea."
How fortunate that she
Right,
recognized that.
she said, "You just stop breathing for long periods of time." So I tried to tell my doctor, and they said, "Oh, you're not the type of person to have sleep apnea, you know."
You're not a man, you're not overweight.
Right.
And that is true that it's more common in men than women, but it most definitely can occur in women, and it can occur in thin individuals.
Right.
So.
But I was finally diagnosed, and one of the most exciting things about being treated, I feel engaged in life.
Right.
It was such a struggle. I felt as though I were swimming through molasses. There was this persistent, heavy brain fog. It was very hard to focus, to think logically, to prioritize, and that's critical in critical care nursing.
Absolutely.
You know, patients' lives depend on my ability to make quick decisions and appropriate and to analyze what's going on. I had found that I was beginning to withdraw socially because it took so much concentration to focus and keep it all together. But now I feel more outgoing, I'm more sociable, I function at a much higher level.
Do you enjoy life more?
Oh yes,
Yeah.
yes, and I can sit and laugh with my grandchildren, and you know, and I don't worry about falling asleep in the middle of a conversation, and it's really given me my life back.
That is a wonderful description of what it was like. You know, the words that you used of trying to swim through molasses, I hear that over and over again, or some, you know, some derivation of that. The common one I hear is trying to run through mud. You know, it's weighting the person down, and it's hard to, you know, as one patient told me, and it has sort of a southern flavor, but he says, I can't get going because I can't get going. You know, it just is hard to mobilize. And I will mention that obesity and overweight is commonly associated with obstructive sleep apnea. And what we find is that individuals with obesity have a terribly hard time adhering to a diet and an exercise program as long as they're untreated. And so we often need to get the diagnosis, get them treated with CPAP, and then they are able to mobilize to exercise and lose weight. So it often goes in that direction. There also are other high-risk groups for obstructive sleep apnea. We know that sleep apnea is more common in individuals of African American and Hispanic background. They're denoting a genetic predisposition. We don't fully understand that, but there's an active amount of research looking at that. So, well, tell us about treatment. How did things go for you once you were diagnosed and you began treatment with CPAP?
I thought, no. I'm going to have to wear this mask at night, you know, I mean, the idea of it, you know.
Yeah.
But once I got a good night's sleep, there was no going back to not wearing it.
Right.
And sometimes I would just almost run to bed, you know, just so I could put it on,
Just
you know,
so
so I
excited.
could get some sleep. You know,
Right,
it was
right.
really, the difference was literally day and night.
Right.
You know. I've gone through a series of the little nasal prongs and the pillows and different little masks. Everyone's been wonderful to work with me to find just the right fit.
That fit is absolutely
The fit
essential.
is critical, you know, and like I say, I look forward to going to bed now because so many times I would wake up not breathing. And I would think, oh, I'm not breathing again, you know, and I just wanted to go to sleep.
Right. Well, that focus on the mask fit is so critical. In my experience, the individuals who have trouble with that transition to nasal CPAP, more often than not, it's the mask fit. And if there's air leak, jetting out, that's almost intolerable to be able to sleep with air jetting off to the side. And we find also that around 10 to 20% of our CPAP patients have some level of claustrophobia, where they feel closed in wearing that mask. And so we have a variety of different techniques and ways of dealing with that. So were you faced with any sense of claustrophobia with your mask?
The first time I put it on, I felt panicked, you know, but I just began to take good, deep, relaxing breaths, and I was gone. I was asleep. You know, so it was great.
That is wonderful. And of course, you were able to draw upon your experiences both as a nurse and with your the relaxation associated with yoga.
Correct. Right. I thought that was interesting when you mentioned yoga. Yoga has been very important for me too.
Oh, that's interesting.
That is,
Yes.
that's another
Yes.
parallel that we've.
Yes.
Well, that's, you know, and I think this touches on another observation that I've had over the years, that the patient's attitude and expectation leading into treatment is highly predictive of how they will do. When individuals come to the process with a can-do attitude that I'm going to get better, I'm going to make this work, it works. I mean, we overcome each obstacle. And 20, 30 years ago, nasal CPAP treatment was not particularly pleasant. The masks were much more primitive and we didn't have very many options. The machines were loud, they were not very portable. Nowadays, we have so many more options to help meet patient needs. We have dozens of options for masks. And the machines are now very small, portable, quiet. We have a lot of comfort features that make it easier for the patient to tolerate CPAP. So I'm glad in some ways that you came to it at a time when CPAP had matured as a field.
Me too. And even though I had to be in my 60s to find out, you know, that I had not been sleeping for who knows how many years, I feel that because of my experiences, I'm more helpful now. I'm more empathetic with my patients.
That's wonderful.
It's an opportunity
Yeah,
to help other people.
That is absolutely wonderful.